Okay, hopefully I've done this correctly. So welcome, TGIF. It is Friday. Glad you guys have carved out some time to be with us today. And we are honored, as always, to be partners with you. Wish that I were there in person, but hopefully those days will be coming soon. We can reconvene. So let me see if I can get to the next slide here. You are not seeing it. Let me see if this is it. Okay. Hopefully, Don, if you'll just give a nod of the head that you see a new screen. Okay, very good. So let's just begin with some here and now stuff. Let me take you back to something that's kind of been on my mind. May, so there's a lot that goes on in May, right? There is Mother's Day, an important day. For my life, there is also my wife's birthday, which is an important day. Somehow we also scheduled our wedding to also be in May. There is Memorial Day, and of course there's the Ride for Hope, which we were unable to do this year. So there's a lot going on in May, which is nothing more than a ripe opportunity for me to totally mess it up. Typically, out of those 3 high holy days of Mother's Day, anniversary, and birthday, I tend to mess one of them up. However, this year, I remembered my wife saying, you know, I think I might enjoy getting a copy of the New Yorker. So I have no familiarity with the New Yorker, but I remembered this little nugget and I got her a subscription to the New Yorker. I'm not a big reader, but I did thumb through this magazine when it arrived in May, and there were a couple of humorous cartoons in there that I thought, well, gosh, this is very apropos during this time. Hopefully the one you're seeing on the screen there. I had to stop watching the news. It was making my own problem seem insignificant. Of course, you can imagine in May, with the coronavirus starting in March, this certainly seemed to have a apropos level of humor. Shortly after that was this one. It turns out it wasn't the giant asteroid that killed the dinosaurs. It was stress about the giant asteroid that killed the dinosaurs. So again, thinking back to May and the type of worries and concerns and stress that we were all dealing with, those seemed funny at the time. I must confess, now today in August, they don't seem quite as funny as they once did back then. Things that levity and humor are more and more challenging to come by. Nonetheless, Ridgeview is charged with the responsibility of trying to articulate a response to all this stuff going on in the world. So we have tried to be faithful stewards of messaging things, certainly creating articles around managing stress and anxiety, appeared in local papers. We've tried to articulate the importance of timely access to mental health care in all of the counties that we serve, and certainly our partnership with you all through the teleconnectivity has been a valuable piece of that. I say all this to say, things that were once funny don't seem to be funny anymore, at least for me, and yet we still have to be messengers of hope, healing, and recovery. So it's been very challenging. It's been very humbling as well to also be asked by FEMA to provide this service. So folks are familiar with FEMA through primarily natural disasters, hurricanes, floods, tornadoes. Very rarely does a health disaster present itself where we are asked to be part of that. Now, what makes this unique, and I've highlighted or bolded just one section there, the particular mission of the crisis counseling program and training program is to assist individuals and communities in recovering from the challenging effects of natural and human-caused disasters. So the reason I bolded this is this recovering from. It's hard to be recovering from while you're still in the midst of it. And we're still in the midst of it. So we are leaning into this whole aspect of supporting, helping people, providing brief counseling services, knowing that we are all collectively in the midst of this health disaster. And I think that's really important to keep in mind. So I'm not going to go through all of these goals. You'll get this in the PDF that I send out, but draw your attention to the fourth bullet there: provide emotional support, education, basic crisis counseling, and connection. This is enormously important. I will kind of conclude with the importance around familial and community support systems and why this is so important in helping us move forward and beginning that recovery process. That second to last bullet there, local stakeholders to promote community resilience and recovery. You guys are a very valuable stakeholder. And some of what we talk about may be especially pertinent to the parent-child aspects of which you guys know all too well. There are other goals there related to this program, but I just wanted to tease out those two as being really vital and important for our time today. There are several services that we can provide. I'm just going to highlight that first one there, individual crisis counseling. We have been disseminating information related to the COVID crisis counseling helpline. I'll be giving you more information on that, but it's a way, it's not therapy, it's anonymous, but it's a resource for folks that are feeling confused, stuck, tired, don't know where to turn, helpless, hopeless, to reach out and get some guidance. Well, first, just to be validated, their feelings are normal and understandable, but that help is out there, and then to be connected to the right resources, whether it's housing, therapy, food banks, you name it. So that's really a key piece that Ridgeview is trying to honor and celebrate. We're doing some public service announcements and public educations and things like this. So those are other aspects. Again, you'll get this in a PowerPoint. Let me rewind the clock. Let me just set the stage a little bit, because I think we forget how what were some themes that we were all dealing with not too long ago. So think back to the tail end of 2019, before we celebrated the new year of 2020. Couple themes were out there. This was one. This comes from the New York Times. It's about listening and a lost art of listening. Part of this reality, I think, is what gave rise to a lot of Brené Brown's work around the capacity to listen to someone's story with empathy and understanding. Is a key mechanism to shame and stigma not surviving. So this was a reality. Listening, really listening, is hard when potential distractions are leaping into your ears every 50,000th of a second. We're dealing with digital distractions, information overload. So again, the context of that pre-COVID, and knowing that this was not necessarily the driving force behind Brene Brown's work, but certainly a critical piece of it is something to keep in mind. Here's another thing. Pre-COVID, most Americans are lonely. All right, so a lot of statistics and data were floating out there. This was a study done on 10,000 people. 3 in 5 Americans are lonely as a result of this study, with a 13% rise since 2018. Again, I'm just highlighting the bold pieces there. Pervasive loneliness is strongly linked to mental health issues such as anxiety and depression. We're not surprised by that. We know that we are hardwired for attachment, for connection. So isolating oneself leads to sense and feelings of loneliness, disconnection. And this was a theme pre-COVID. Okay, so again, just hold that in mind. Another theme that was emerging, we know this through the Building Strong Brains ACEs work, that misattunement is an invisible ace. This particular opinion was offered out there. And I think it has a lot of truth, especially when we think about, and you guys know this very well with the parent-child relationships, how important it is that parents attune to the needs of kids, that they pick up on those cues and clues that kids are offering, and that those needs are met. That's part of what builds a secure attachment, a secure base, and furthers not only healthy brain development, but ultimately this frontal cortex being appropriately functional. So it's not limited to just kids, though. Even adults may often feel unseen and really empty on the inside, as well as chronically dissatisfied in spite of trying really hard to make things work. We feel stuck. People aren't really holding our thoughts and our feelings the way we want them to. So think about that for a second. This is all pre-COVID. These were emerging trends that were out there. Lack of listening empathetically to people, misattunement and inability to attune to one another, and a growing sense of loneliness. You can tell where I'm headed with this, right? So this other one, this was a more recent one during COVID, Vanderbilt study. 27% of parents felt like their own mental health had worsened since COVID. 14% of those parents saw negative changes in their kids. Not a big surprise, right? I mean, we're talking about the exacerbation of some of those themes that we were dealing with culturally and as a society. Information overload, bombardment of technological information, lack of empathy for one another, loneliness. So pre-COVID. Now let me just pause right there and show you this picture. Breathtaking vista. I love looking at that picture. I could stare at it for hours. I always wonder, where is this on the planet? I'd like to go there one day. I just kind of get lost in this breathtaking vista. Now, you may have heard me say this before when we've done some of the Building Strong Brains work. You know, there is, I believe it was Michael Novak that said, parenting takes us to breathtaking vistas of our own inadequacies. As a parent, I found that message very true. It does. Parenting is hard work. Foster parenting is hard work. Adoptive parenting is hard work. And though it's full of many joys and insights, it can also bring us to a great deal of insight of some of our own fallibilities. So I got to thinking about that as it relates to pandemics. So I just kind of took Michael Novak's statement here. Pandemics, or health disasters, take us to breathtaking vistas of struggle, confusion, this technical word, discombobulation, and compromises our ability to optimize good mental health. I think it's true. I've felt all those. I still feel those. And many times, each and every day, I'll touch on an aspect of those. So I think we have to acknowledge. And I guess I'm hearing some other chimes come in. If folks could please mute your computer or your phone, that would be fantastic. So I think we have to begin with some realities of where we are, not only over the course of time, again, loneliness, misattunement, lack of listening and empathy, how all those things are magnified as a result of the pandemic and what this health disaster has brought to us and continues to bring to us. Okay, so stay with me here. That's why it is critically important that we be a steward of our own mental health, first and foremost. You know, this is, again, in an airline, you'd say you got to put your mask on first. Now we say you got to put your mask on first. So we all keep these things nearby. But stewardship is a careful and responsible management of something entrusted to one's care. So I do think we have to be stewards of our own mental health. Why? It helps keep us calm. We're able to modulate better, get through the day. It models effective coping for others, not just in our family, but of our coworkers, our colleagues, and the people we serve. You folks are in the helping industry. People come to you when their life is not at their best. Families are falling apart, and you have to model effective coping. And ultimately, it helps us respond instead of react if we can be good stewards of our own mental health. So let me take you to this slide. There's a lot on here. We're not going to absorb this all in one minute. So let's just start in the top left-hand corner there. Escalating mental health concerns in the deep water of COVID-19. We're specifically using the metaphor of deep water because I think it's very true. If you've ever been out into a big lake like Norris, if you've ever been out in the ocean and gotten way away from shore where you can't see the bottom any further, it taps into some primordial metaphors that we all share, especially if you can't see the bottom, you don't know what's out there. Maybe you don't see the boat is no longer nearby. Maybe you don't have a life vest on. Maybe you're not the best swimmer. All these things lead to a great deal of uncertainty, fear, concern, the unknown. Ultimately, it's the unknown. And I think there is, we don't know the future about COVID-19, this health disaster, and living with that uncertainty and these looming questions feels very much like we're in a deep water of stress and anxiety. So let's just stick with that metaphor for a second and move to that left-hand box there. People feel differently about this. There are lots of feelings that we have. But I think we could all resonate that at some point in time, we have probably felt feelings associated with the deep water of COVID-19 with some of these. I might feel depressed and certainly despaired. I may feel angry, anxious, tense, not just tense up here, but bodily tense, shoulders tense, back tense, lonely. I've been asked to physically distance, and a lot of the messaging has even been around social distancing and what that does to us, exacerbates feeling of loneliness. I feel stressed constantly. We know, again, through our Building Strong Brains work, that stress is not always a bad thing. It needs to modulate. But let's be honest with each other. We've been living in a heightened chronic level of stress since March. That's a long time to be living with that type of chronic stress. We may feel a craving to self-medicate or numb ourselves. I want these feelings to go away. At least for a little while, I'm not feeling it and dealing with it. Feelings of fear, feelings of guilt. I had a wonderful discussion about this with some of the folks at the Roane County Health Department earlier in the week, where some of them have actually felt guilty about having a job where they're still able to come in because they're essential workers. You in the helping profession are essential workers like us. How horrible to have to carry with you a feeling of guilt about being employed, but it's out there, it's real. And struggle profoundly. I think struggle is a great word because it connotes a wrestling. It is. It doesn't really portend an end. It's an ongoing wrestling struggle that we're dealing with, and of course, feelings of just plain old fatigue, tired. I think there's a football coach, Vince Lombardi, that says, fatigue makes cowards of us all. I don't like the word coward a whole lot, but I do think that we all have a point where it gets to be too much. So the deep water of COVID-19 leads us to feeling things like this, and many more. There are more positive ones. Maybe for some of us, it makes us feel resolute. But what I think it's important to do is for us to highlight maybe where the hardship is for people and why they need a program like this and services like yours. Now, we all react differently to stressful situations. So let's move over to that middle box. Our body keeps the score. We'll talk a little bit more about the work of BESSEL, KOLK, but when your body feels tense, when you're not feeling yourself, when you have a sense of a chronic fatigue setting in, that's not that there's something wrong with you. That is our mind and body are intimately connected, and we see it in our kids. When kids that are going through adjustment of a placement, they have tummy aches. We see it when couples go through a breakup and they have heartache. When we experience things that are gut-wrenching. These are all phrases and words that are appropriately used because our body does keep score of what's going on in and around us. And I think it's something we have to be mindful of. Other reactions to stressful situations, heightened levels of dysregulation. My frontal cortex, I'm always feel like I'm offline. My executive functioning is offline, and I'm just solely operating from that amygdala part of my thinking and my brain. Paralysis. Other folks respond with a freeze. They don't know what to do. It exacerbates isolation, loneliness. Of course, something we're both all too familiar with, compassion fatigue. Those in the helping profession like you, teachers, law enforcement, health department, medical field, the list goes on and on. Helping professions deal with compassion fatigue. I don't know how much more I can give. A nihilistic outlook. We probably all know someone who is beginning to express more and more of that. Why bother? I'm over it. You know, this is the end anyway. There's no need to really work towards a recovery because this is the end. Some people have that response. Violence, by gosh, I have felt a lot of it out on the roadways. There's a whole new level of road rage that I don't think I had ever experienced before. Domestic violence, there's an increase in that. Suicidal thoughts, great many people who have lost jobs, lost incomes, lost their housing, the uncertainty of how long they have to live with financial insecurity, have lost purpose and meaning through either their vocation or their relationships. The world would be better off without me. These are all very common responses in the face of disasters, in particular, chronic health disasters. And of course, an increase in substance use, that numbing effect, and a whole lot more. If we were in person and I wasn't having to mute everybody, we could, I would love to hear from you what responses you have felt or see most often. Let's move to that far right box now. We're trying to get some forward movement from this stuck spot that we're in. Organizing a daily schedule that helps you clarify what is most important so you can move forward. This is critically important. It's something I've had to do. I've had to take ownership of, responsibility of. I've had to take stewardship of, is organizing a schedule to help me move forward. A lot of these things may seem superficial to some. We know through science, through research, that this works. These are helpful steps that can be taken. Obviously, taking care of yourself, but the key phrase is intentional strategies. You have to be intentional about making these things happen. What's an example of that? In March and April, when everything seemed to go on lockdown, and I was trapped, imprisoned in this office. We were still reporting to work, just like you folks. And I had to get out of this office. I had to be intentional about strategizing that. So every 2 hours, I would go outside, take a walk around the block. Every day at lunch, I'd put on a podcast and I'd go walk 2 miles around Oak Ridge. There's very little traffic out there, but it was that intentional strategy that got me out and moving, my body moving, which was critically important. If I had waited for that to happen, I think I'd still feel imprisoned. Taking breaks from news and social media, this is a hugely important thing. I can't stress this enough. I had to dose myself. At first, I was listening to every governor news briefing. I was watching the news when I got home. I was staying acutely abreast of everything on social media. Oh my gosh, yeah, I was becoming a person I no longer wanted to be. I was becoming a husband I didn't want to be, a father I didn't want to be, a man I didn't want to be. I had to start microdosing when and how I got information. And I can't tell you what a godsend it is. It's been probably the healthiest thing I've done in terms of organizing and structuring things to help me move forward. Obviously, taking care of your body by eating well, we know that certainly makes sense. But our bodies, since they keep the score, it's all the more important during a health disaster of this type that is chronic, that we are taking extra measures to stay well hydrated and eating as well as we can. Practice mindfulness techniques throughout the day. That does not mean, and I'm a victim of this, I used to kind of have a cynicism about mindfulness. I didn't quite get it. I didn't know what was meant by that. But I think there's an attunement, going back to that word, just about your body, that is very helpful and healthy to do, to periodically throughout the day, whether you start at your head or start at your toes and you work either direction, and just think about, what is your body feeling? Where is it storing the stress, the anxiety, the tension from everything that we're being asked to cope with? Is a really healthy thing to do. Other activities you enjoy, again, if we were together, I would say, tell me, let me hear from you as well, ways in which you activate your body or your mind. And of course, supportive conversations. That's going to be something we conclude with, but I can't emphasize that enough. I'm trying to be mindful of time here, so let me continue on. Again, this slide here, you'll have this in the PDF. It can be helpful to you, I think, and schedule is how we make our intentions manifest in the world. That, again, we've got to schedule recovery, schedule well-being. Back to our good friend, Bessel van der Kolk here. We recently did a presentation on him at the Oak Ridge schools, and it's a book that is chock full of information. But, you know, I got to thinking, what would he tell us today based on his work and research? What would he tell us is most important? You'd be amazed how many times curiosity and curious, that word appears in his writing and in this book. But certainly with our kids, with the parents with whom you work, with our co-workers, we have to be curious about decoding what drives our behavior. Where is some of the behavior coming from? Because the behavior is a coping mechanism, right? We have to be patient with ourselves, with others. This is a very uncertain time, and patience is a virtue that is a precious commodity right now. Be a secure base for children and one another. Again, we are hardwired for connection. It's from that secure base that we're able to get out and deal with challenges, with struggles that we experience on a day-to-day basis. Be mindful. With this next slide here, I'll emphasize a little bit more about, I want us to actually read this thing. This is so powerfully important to me. Being able to feel safe with other people is probably the single most important aspect of mental health. Safe connections are fundamental to meaningful and satisfying lives. Numerous studies of disaster response, that's what we're in right now, folks, disaster response, around the globe have shown that social support is the most powerful protection against becoming overwhelmed by stress and trauma. Well, I mean, there's a medical opinion for you about what is most important. Social support, number one thing. So as we begin to turn towards resilience and strengthening, deepening our efforts to improve and promote resilience, that may be number one right there, is promoting social support of one another. For the public child welfare system, this is critical. The parent-child connection is the most powerful mental health intervention known to humankind. So we know kids that come from hard places, borrowing a phrase from Karen Purvis there, kids that come from hard places don't have the benefit of this of a healthy parent-child connection. We have to work towards helping create that. And if kids don't have it, maybe we're the ones that have to be that for them. Teachers have to be that for them. Excuse me. So that's something to keep in mind, you know. Obviously, therapy, outpatient therapy, school-based therapy, telehealth therapy, they all have their role. They're all critically important, but they alone are not the answer. Relationship here is emphasizing what an important role that is. And obviously, mindfulness is not to make it possible to survey our internal landscape with compassion and curiosity, but can also actively steer us in the right direction for self-care. So listening to your body, what is it telling you it needs? Extra rest, extra sleep, extra social connection, extra activity, get out and walk around, those types of things. All right, so let's shift our gears to resilience. We know this is an antidote to a lot of the deep water of COVID-19 during this health disaster that we're currently in. Resiliency during a pandemic. Now, some of these things we've covered, and again, you're going to have this in the PDF that I send Donna to share out with the group, but there are resilience building activities, things that can be done. The word I want to highlight for both of these columns is that word activities. Active, it means having exercise choice, exercising agency. We have to choose to do some of these things. We have to be intentional about integrating these things into our daily structure and daily routine, even when we don't feel like doing it. That's the crux. We don't feel like doing some of this stuff. That's where the social connectedness with others can really be helpful in helping us move forward. Self-care, same keyword, activities there. Some of these we have covered, so I'm not going to dwell on these. I've given you some highlights of what those look like, what they can sound like. And again, if we were together, I would love to hear your thoughts on what's working for you or for people that you know. This too, we're not gonna, because I'm sensitive to time, we're not going to go through all of these, but these two are ways to promote well-being, to organize and clarify resilience. Again, look at each of these when you get the PDF and see what's one thing I could do to connect, to be active, to keep learning, to take notice, or to give. All of these things are evidence-based practices that help build and promote resilience and help us optimize good mental health. Certainly places to look for. There are other publications, support groups, that last bullet there, a licensed mental health professional. You guys know Ridgeview, you know other providers in the area. We're delighted to have a teleconnectivity with you guys in your each county location. Use us, make those referrals when and as needed. Again, I'm not going to spend a lot of time on this slide. So let me move towards concluding with this. This is a pearl that was given to me years ago, and I had, to be honest, I had forgotten about it. I was reminded of it in the midst of everything that we're going through, and I want to share it with you. I had the very good fortune 7, 8 years ago, it may have been longer than that, 8 to 10 years ago, of interviewing a psychiatrist. We were doing adoption work across the state. And so his specialty was on the parent-child relationship. I asked him one question at the end of this interview. If you had one pearl to give parents who are struggling with fostering or struggling with adoption or just struggling with knowing how to manage kids from hard places, what piece of advice would you give? So this was, he essentially quoted Calvin Coolidge. He didn't quote this exactly, but he said essentially, persistence will carry the day. Persistence and determination are omnipotent. That's what parents need to do. So we concluded the interview, things went on, we taped it, we packaged it. A week later, in the mail, I got a letter from him. And this is literally that letter. I want you to look at this last paragraph here. On my drive home, I was pondering your last question regarding a pearl. I kicked myself for not remembering one of my favorite quotes by Thomas Merton, which I'll include with this letter. The bold and underline are mine. Well, you can imagine. I was like, oh my gosh, this is what jewel, what pearl is he regretting he didn't share? This is what he shared. This is Thomas Merton here. Thomas Merton was writing, this was in a letter to a friend of his in 1966 who was dealing in the midst of the exploding Vietnam War. He was trying to do work with peaceful resistance. It was a despairing letter. Thomas Merton wrote back to him and wrote this in the letter. I want to just draw your attention down towards the end. You gradually struggle less and less for an idea and more for specific people. In the end, it is the reality of personal relationships that saves everything. Now, why that? Why share that piece? Because I think when we know that social connectedness, which is what we're hardwired to do, in the face of social distancing and physical distancing and barriers of this sort, we have to now honor more than anything the relationships that we have with other people, whether it's your coworkers, your colleagues, your family members, your neighborhood. Think about where you can draw strength and give strength to those relationships. It's a gift that was given to me that I can't help but share with you. This is Dr. Otto KOLK, and sadly, he passed away earlier this year. It was not COVID related, just natural causes. But the invitation is this: develop and nurture personal relationships. They are key to promoting resilience and transcending struggle, which is what we're all doing. Here is the Contact COVID Crisis Helpline. We are marketing this in newspapers, on our website. It is in the promotional materials that we give out that look like this. You probably have already seen these. Feel free to post these on your your cork board, share the information on Facebook, help spread the good news that there are people out there waiting to be that ear to listen with empathy and understanding, to help people move forward in the midst of this health disaster when we don't know what the future holds or when it may end. Obviously, you guys are already aware of this, our partnership with you all. Look at Leah smiling right there. Isn't that pretty? So here's the flyer. If you guys need that to send out, we certainly can. Locally, I think the folks that are on this webinar are from Anderson and Campbell County. Where to get help in Anderson, our main center, the location is, oh my gosh, I didn't put the address down there. I'm so sorry. But it's on our website. We've got a walk-in, same-day access walk-in clinic. We also have the emergency mobile crisis team, which is for psychiatric emergencies. We also, of course, have here our Campbell County folks. There's the, oh my goodness, I got the wrong, we've moved. We've got a new location. I need to update that. But they're a team of those folks looking and ready and willing to help people out. That's a gobload. We got a little late start, but I wanted to promise to end on top of the hour. I hope I'm going to unmute all if I can. Let me see here. Okay, I have allowed everyone to unmute. If there's anything, you have any questions, comments, concerns, please don't hesitate to let me know. And anyone feel free to say anything just so I know that someone heard all this stuff. I think you should be able to unmute yourself, I hope. Still not working.
There we go.
A voice.
Yay. Yeah. Hey, thank you so much, Michael. Truly great presentation. And I think it validates the feelings of our frontline staff who've been in this from day one. So I think that was very helpful.
Yeah, unfortunately, there are not easy answers to this. There's just got to be a commitment to be there for one another, to I think find out what simple doable steps that each of us can take to help move us forward and to support one another in the midst of so much destructive communication out there. Anyone else have any questions or comments? Well, certainly, Donna, I will send this to you. You can disseminate it to your folks as you see fit. And if there are pieces of this that people did not find helpful, I would welcome knowing that too. We're always, the beauty is it's a dynamic community education piece, so we're always looking ways to refine this, to sharpen the message and make it more helpful to people that receive it.
Does anybody have any questions for Michael or comments before we finish? There's nothing in the chat box. So.
Oh, good. I'm glad you're looking at that. I forgot all about that. Let me look here. Yeah, I don't see any comments in there.
No. And just another reminder for staff, if you've not already, put your information in the chat box if you want to email that to me. I think we've got a couple folks that are participating on the phone. If you send me your name and employee ID, I can make sure you get training credit, but also send you the PowerPoint once Michael sends that to me.
Well, thank you. You guys have a great rest of the day. Be good to yourself. Be good to one another. And again, we're honored that you would carve out time to let us spend some of the Friday with you. Keep the faith.
Yeah. Thank you, Michael.
All right. Thank you, guys.
All right.